According to the National Institute of Health, 6.5 million people in the United States suffer from non-healing or chronic wounds. Recent estimates show the cost of chronic wound care per year is $25 billion. The good news is the ability of scientists and doctors to harness our own body's healing mechanism is on the rise, and these novel treatment methods just might be the new gold standard. Joining us to share this latest innovation in personalized medicine for wound care is Dr. Bob Bartlett, Chief Medical Officer at Restorix Health. Welcome to the show, Doctor.
Thank you, Erica.
So let's get right to it. How would you define chronic wound, and what are some of the most common ones you've dealt with?
Well, a chronic wound would be any wound that is failing to make progress after 30 days. Typical wounds that can go into a chronic state would be people with diabetes. We oftentimes refer to these as diabetic ulcers. Then there are patients who develop pressure ulcers. This is much more common in the aged patients who are not moving around. They stay in bed a long time. A third chronic wound that we find is the venous ulcer. These ulcers are a result of the valves in the vein that begin to fail, and you develop very high venous pressure, and the skin breaks down and ulcerates.
We're hearing more and more that chronic wounds are significant health problems. Why is that, and how important is the chronic wound care centers?
The mortality for chronic wounds is actually greater than many of the common cancers, like colon cancer and prostate cancer. But it is only recently that we're starting to see wound centers popping up all over the country. And it largely reflects the fact that, number one, it's a big burden in the community, so hospitals are trying to respond to that burden. And secondly, it is difficult for providers to keep up with the latest and best techniques. So by concentrating this expertise within a center, then you're able to have at least one group really focus.
What are the treatments that are available?
Sharp surgical debridement, curetting and cleaning a wound of some of this tissue that's just not growing and repairing. Then we see hyperbaric oxygen, where we're driving oxygen into the tissue. Silver has been found to be very effective in sterilizing and cleaning out germs and bacteria that would otherwise prevent healing. And then following that comes the fourth wave of innovation, which is what I call the biologicals. The use of artificial skin and tissues. It can be grown in petri dishes. But we're now on perhaps the most exciting phase, which is what I call the phase of regenerative medicine. Where chronic wounds are involved, what we're doing is we're harnessing the strategy of regenerative medicine by harnessing the patient's own healing powers from within. Specifically, we're using the patient's platelets, concentrating these platelets and magnifying the healing properties of these platelets 100-fold. NUO Therapeutics has developed a process and a product called Oryx.
Okay.
Oryx is recognized by the Food and Drug Administration. It's actually been shown in clinical studies to accelerate the healing process.
So, doctor, tell me, exactly how does it work?
What you do is you just draw about 10 cc's of blood, just like any other blood test that you routinely get at a hospital. We then spin that down to separate out the plasma and the other red cells. And it's really within the plasma that most of the platelets are found. And the plasma has a sort of a yellow gold color, and that's why we refer to this as Oryx. It's like the gold within you. But it was really through a lot of scientific study that people figured out how to mine that gold, to harvest it, to heal these chronic wounds. And then you take that fluid and you put it down on the wound bed.
Just a topical application.
It's done usually on a weekly basis for several weeks. It also is painless. So we put this rich gold gel onto the wound bed, and it spreads across the entire surface. And it penetrates into the edges. It goes down little sinuses, nooks and crannies, where a lot of other things simply don't reach. And that's important for stimulating the healing from the wound bed. And this causes what we call a change in the healing trajectory, which is basically the speed at which the wound heals. What we've done is to take the human body's healing potential and then we amplify it, and we find that many chronic wounds that are not responding to some of the more traditional therapies, in fact, will respond when we put the Oryx in there. Now, the nice thing about Oryx is that nobody's allergic to it. It's your own platelets.
What is the cost, and do your insurance companies cover it?
So cost, I suppose, is really a relative term, relative to the cost of amputation and the cost for quality of life and suffering and so on. This is really cost effective. But to better understand the cost effectiveness, Medicare is paying for Oryx therapy. They're paying for it, though, under a special program called the CED, which is coverage with evidence development. They want to better understand who's going to benefit and what are the best ways to really use this new novel therapy for all patients with chronic wounds. It's also being used today in a number of Veterans Administration hospitals, not only to take care of our aging veterans, but some of the veterans with difficult war wounds that are not healing. Again, this is an excellent strategy for those patients.
Such great news, Doctor. What a wonderful technology, and it brings so much hope to so many people. Thank you so much for coming here today and sharing all that information. And if you want to find out more information, you can go to oryxsystem.com. You can also go to our website at accesshealth.tv.